Emergency management for prolapse of the umbilical cord. Assessment. For the assessment, assess the woman to be transferred to the nearest consultant unit or hospital for delivery, and assess the woman's ability to follow the instruction. The planning, gather all items that you will need for internal examination and for double setup. For internal examination, we have here 1 pair of examination glove, 1 lubricant, and for vaginal delivery, we have 2 sterile gloves, 1 straight forceps, 1 Mayo scissor. I have improvised urinary catheter, 1 placental basin, 1 needle forceps, and 1 syringe with needle. And I have 1 chromic tube, and 2% lidocaine, and cotton balls with betadine. Identify the client, introduce yourself, and explain the procedure. Good morning, ma'am. I'm Mary. I will be your student nurse for today. Can you state your name, ma'am? Okay, ma'am. How old are you? Okay, ma'am. How are you feeling right now? Okay. For today, ma'am, I will do the internal examination where I'm going to insert my glove fingers into your vagina to assess the progress of your labor. Is it okay to you, ma'am? Identifying client and introducing yourself and explaining the procedure will obtain the client's cooperation and work simultaneously. Position the client on the examination table. 3 positions are employed for internal examination. This is dorsal recumbent position, Sims position, and niches position. Aforementioned positions are made best so as to expose the gynecologic area to be examined. Position depends on the client's capability and examiner's preferred position. Drape the client and expose only the gynecologic area. Ma'am, I will apply the drape on you and to expose only the gynecologic area and the area that I only need to assess. This procedure respects the client's modesty and providing privacy. After applying the drape of the patient, begin to wash your hands thoroughly and put the examination gloves. Assess the well-being of the pregnant woman if the cord is visible outside the vagina or can be felt in the vagina below the presenting part. Ma'am, I'm going to insert my 2 fingers into your vagina. While I insert my 2 fingers, kindly take a deep breath while I'm doing the internal examination. If I see the cord protruding on the vagina, I will handle the cord carefully and I will do not pinch the cord. After performing internal examination, assess the fetal well-being of the fetus, the fetal heart rate. Ma'am, I'm going to assess the fetal heart rate of your baby. I'm going to put a stethoscope on your abdomen. So don't worry, this will not hurt you and your baby. Cord prolapse is first discovered only when the membranes have been ruptured, when the fetal heart rate is discovered to be unusually slow, or when the variable deceleration fetal heart rate pattern suddenly become apparent on a fetal monitor. If you are in CMOC facility, report the findings to the obstetrician for emergency medical section. If you are in BMOC facility, do the emergency management for prolapse of the umbilical cord. Assist the mother to do the head tilt, knee chest, left lateral position, and instruct the mother to take a deep breath and control the urge to bear down. I will assist you in a knee chest position, so take a deep breath and do not bear down if you have the urge to do so. Knee chest position and uses the gravity to shift the fetus out of the pelvis. Elevate the presenting part by filling the urinary bladder and by inserting the urinary catheter. Ma'am, I'm going to insert a urinary catheter to fill your urinary bladder with the sterile fluid. Is it okay, ma'am? Okay. now the urinary catheter. Take a deep breath, ma'am. Okay, the catheter is in. The urinary bladder should be filled with 500 to 750 ml of sterile fluid. Once it is already filled with 500 to 750 ml of sterile fluid, we clamp. Elevate the presenting part by inserting your fingers into the vagina to push the head of the baby upward. Ma'am, I will put my gloved hands into your vagina to push the head of your baby upward. Take a deep breath when you have the urge to do so. I will do not remove my fingers until we arrive to the operating room or by instruction of the obstetrician. I will call out the time of birth and gender of the baby. Time of birth 7:15 a.m. It's a boy. If the baby is in good cry, I will do the EINC. If the baby is not crying, I will cut the cord and do the resuscitation if needed. After that, I will remove my gloves and dispose it properly and do the hand washing. This is for infection control. After the procedure, I will document the date, the time, and the procedures I've done to my patient. This is to provide accurate data and the care of my patient.